Welcome to the ACCCN Advisory Panel webinar series, and today we have the Education Advisory Panel presenting using the ACCCN Practice Standards. We have Melanie Greenwood, Professor Carol Gresh and Julie Smith. So welcome, and I'll hand over to Melanie.
Hello everybody, and thank you very much for listening in to this session. As with all sessions that are delivered in this medium, we will try and be short and to the point, but we hope that the presentation will raise some issues for you, which we're more than welcome to take questions via the Education Advisory Panel, just contacting any of the members, either a state representative or through the national organisation. So the aim of the workshop today is to provide you with an understanding of the Australian College of Critical Care Nurses Practice Standards for specialist critical care nurses and how they can be applied in practice. The standards were developed as a part of a research project, and we may talk to that during the session. So it's useful if you do have access to the standards during the workshop, but we understand if you don't, so I've actually got reference to those in this session. However, be aware that the standards can be purchased through the ACCCN website. So I'm going to hand over to Professor Carol Gresh, who will talk to you about why the standards are very important for specialist practitioners.
Hello everyone, my name is Carol Gresh and I'm pleased to be involved in this webinar. Broadly, to set the scene, we need to look at differentiating between competencies versus the capable nurse. And on this slide we have some key points, particularly around the capable nurse is often easier to recognise than to measure because it does have subjective elements, and as such tends to be simplified and measured by distinct competencies, and I'll talk a little bit more about that in a moment. But I think it's important for us to be clear about what we mean by the terms competence and competencies. So in terms of competencies in the context of nursing practice, they are often interchangeably used with the term competency standard, and these refer to the attributes of a person that results in effective and or superior performance. And specialist competencies in this context for the critical care nurse really describe the higher level performance as compared to the standard expected of an entry-level practitioner. So why the capability is best considered within a holistic framework of which competency is only one aspect. And the practice standards really look at the specialist level for critical care nurses, and we'll come back to that a little bit later in the presentation and apply that thinking to some of these scenarios. So competencies can be measured, and they do measure present knowledge and skills, whereas, as we've already said, the capability embracing competence is forward-looking and reflects a dynamic and changing workplace. And certainly that's the context in which nurses actually practice. So we'll just move to the next slide. And I might need you, Melanie, just to thank you. So here we're looking at the future in terms of a capable nurse who would meet the standards required of practice. And as Melanie indicated in the introduction, ACCCN has worked really hard to define what practice is, and has done that within the first set of standards that were developed that were based in research evidence. And so they've been crafted and refined to where we are now, to the practice standards for the specialist critical care nurses, which we're going to tease out a little bit more. I would also add that the nomenclature now is really moving away from the notion of competencies to practice standards, which really reflect a greater sophistication about the capabilities that we've been talking about. Whereas competencies now on the national level tend to be used more around defining specific tasks or skill sets that we often see within the vocational education sector. So I'm going to hand back now to Melanie, who's going to talk us through the historical timelines in how the competency practice standards have been developed.
Thank you, Carol. So, as Carol has alluded to, the standards were developed quite robustly way back in sort of the 80s. And after when the Australian Nursing Council published the Nursing Competence Assessment Project, that's when there was quite a very large study undertaken, which resulted in 1996 the specialist standards being first published. Now, they were based on watching what nurses did at the bedside, so they very much were intended to capture the level of practice of the nurse who was already proficient in the workplace. So they were not designed to capture a beginning level practitioner. Since that time, the standards were then reviewed in 2002 to be published as the second edition. And that was, rather than going back and replicating the study that was originally, which was involved with observing nurses, interviewing nurses, looking at documentation, and then pretty well consensus meetings to develop the original standards. In 2002, what we did was we looked at seeking opinions of nurses to see if the standards still met the requirements of practice and to capture what nurses were doing at that time. Again, since that time, we've replicated that original 2002 study to gather evidence from practitioners, but we added to that focus groups to seek opinion about what had changed in terms of practice. And so that the standards that have been just recently launched by the college, we believe do reflect contemporary practice, and they also extend into differing scopes of practice, because the researchers found that whereas there was consensus agreement through the eDelphi research project, that the perhaps scope of practice had changed slightly in terms of we now had different roles, and that was evident in the focus groups that were undertaken as part of the project. So that the current standards are intended to be broad enough to capture work roles such as liaison nurses, nurses who are working again back into education roles as well as in practice, working in maybe a neurointensive care, cardiovascular intensive care setting, or a general intensive care setting. So we've tried to reflect contemporary practice, which also includes advances in technology. So you'll find that the standards are really designed to not only capture practice but also to mirror what is expected by regulatory authorities in terms of the Nursing and Midwifery Board standards. So we've defined the practice standards to include 4 domains, so again aligning them, because that's what the research project found, that rather than the critical care practice standards to stand in isolation to what was happening for other nurses. They needed to mirror those, but obviously towards focusing on specialty practice. So we've aligned them to professional practice domains, provision and coordination of care, critical thinking and analysis, and collaboration and leadership. So on this next slide, I'm just going to, I'll let you do reading. I won't necessarily read them out to you, but the practice standards under those 4 domains are broken down into particular discrete areas. So under practice, professional practice, we have standards 1 to 4, which is really sort of reflecting the legal and ethical parameters, the rights of patients and families, accountability as really important standards that meet that practice domain. Under provision and coordination of care, we're now focusing in on not just the patient but also the family. So it's not only providing the patient and family-centred care, but also promoting comfort, well-being in unfamiliar environments. It goes right through to Standard 8, where we're actually now looking at coordinating care of a variety of patients, but also therapeutic interventions. In terms of critical thinking and analysis, then we're looking at how your assessment skills underpin that practice domain. So that goes through again to Standard 12. So looking at responding to changing situation, planning care, and engaging and contributing towards evidence-based practice, which is really important, that is focusing on specialisation. And our final domain has 3 standards. So collaboration outside of nursing, also looking at enhancing professional development of self and others, and that supportive environment for all members of the healthcare team. So again, there's not a lot of change that came out of the research. However, there was some streamlining that occurred, which is really important. So in terms of us moving forward through to the rest of the delivery of the session, what we're going to do is to look at how the standards can be used. So Carol, did you want to speak to this? I've put the slide up. And you'll need to unmute your microphone.
Thanks, Mel. So let's look at the application of the practice standards, and there are a number of ways that we can look at applying this. And it was interesting when Melanie and I presented at the ICE conference earlier this year, where we looked with the audience around the various ways that the practice standards can be applied. And so here you can see some broad areas, certainly to inform curricula, and again that's particularly applied to the graduate certificate or graduate diploma programs within critical care nursing. And Dr. Fenella Gill has done some really interesting research around this whole area of informing curricula. And again, in one of the application scenarios we've got for you, you'll see some of the work that Fenella did in looking at conceptualising how these practice standards can be used in terms of the development of knowledge, skill and learning, as well as attributes around behaviours and attitudes for critical care nursing. So certainly there is great application for the standards around how they will inform postgraduate critical care nursing curricula. They also generate discussion around practice and performance development. So for those senior nurses who are working within critical care and are line managing staff. They are a fantastic tool to actually have in terms of being able to sit down with staff members and have conversations around are the staff member, particularly if they are an experienced critical care nurse, are they meeting these practice standards? And if not, it potentially opens the door around conversations as why not, and what can we potentially do to ensure that you in fact are meeting the required standards. They also define the scope of practice in a variety of critical care contexts, and Mel's already mentioned the application, so that they're written in a way that they're very broad and can be applied to multiple settings in which critical care nursing takes place. So we're now moving on to look at introducing the activities. And Mel, I'll hand back to you, and I'm happy if we work through one each, and we'll see how we go in terms of timing.
About this, how you would do that. Of course, if anybody has a microphone, they're more than welcome to speak.
Carol and Mel, it's Julie Smith. I apologise for being very quiet in the background here. I would have thought that in the situation for Sophie, we would be looking at the collaboration and leadership domain as being a guiding place for our standards for the people who work with her. Standard 13 is pretty specific about how we collaborate with a critical care team. How do we help lead, and how do we help guide those people who might be ready to make those next steps in their profession? I think the standard there is really, really quite simple with standard 14, in that we should be expecting as part of our standard at that point in our career to not only enhance our own professional development, but to be enhancing the professional development of others.
Thank you for that, Julie. That's a wonderful answer. I think I tend to agree, and I think that in terms of how you'd apply that particular standard to yourself as being the mentor, I think that would work very well. And so that would be something that you could then capture against your own performance, perhaps to showcase against some sort of planning for yourself to show that you're supporting someone to work to a higher level. I guess from my perspective, I'd be making sure that I'd be sitting down with Sophie to make sure that she felt comfortable in all of the other domains as well, so that she was able to facilitate care for a variety of patients that might be admitted to a critical care area. So she at least had some experience of the types of patients that she was nursing, potentially going to be responsible for. For example, if she had never cared for somebody on intra-aortic balloon pumping or counterpulsation, then it's going to, she would need to ensure that she had people on her team on that particular shift where she was coordinating that did know how to troubleshoot and problem solve in that area. So it'd be making sure that she had the experience, but also that she was supported if she was ever put in that position of being a leader. I'm happy to take any comment on that. Wish to talk, you need to.
A little further to how I see the standards supporting people like Sophie is that process that a lot of critical care units will go through, where you have someone who's working towards being a shift coordinator. They will buddy up with a more experienced person who has, as I say, lots of experience being a shift coordinator, so they can actually learn on the job, almost the old-fashioned watch one, do one, teach one process. But it does allow them to ask questions rather than trying to sort those things out when they are it, when there is no one there to support them. It's also vital that when we do move someone up into a shift coordinating role, all of the things you've said about making sure they're aware and have had experience with the various different clinical competencies that they might have, technical things that they might have had to have achieved. They are also those things that when you're developing or leading someone to change or to move past a level that they're at, that's part of our professional practice, where we need to be mindful that, okay, have we actually ticked the boxes? Have we gone through each of those things with that individual? So it is very much a dual, well, I see it as very much of a dual process, where it's not just the person who's learning to make that transition, it's the person who's helping them make that transition. I think the standards are actually a really nice way to almost guide them through that transition.
That's lovely. Thank you for that, Julie. And so I suppose in summary of this particular sort of workshopy type activity, it could be seen as something fairly easy to facilitate, because obviously her key underlying attributes are there in that she's motivated, she's settling in well, which presumes then that there are no issues that have been reported to you by any of the others, so she's actually able to be seen as a team member. And so this may be quite a staged process to actually assist her to get to that role of a more senior practitioner, able to take on a leadership component. So it's probably been sitting down with her and having a staged plan, ensuring that learning opportunities were provided for her, and that there was regular feedback occurring for her at different stages. So thank you for that. I'm going to hand over now to Carol, who will do the next.
Thanks, Melanie. So the second scenario involves Mary, and she's just completed her transition to professional practice program or graduate year, and has been just appointed to your critical care unit. She's obviously keen and wants to commence a graduate certificate in critical care nursing shortly. Early reports, though, indicate that she is struggling with her time management skills and is generally disorganised in her work. So, using the ACCCN Practice Standards, we'd like you to identify which standards you would focus on in the first 3 months of Mary being employed in your unit. And I think this is, for me, quite a common scenario that we see. And often, if you do get people into a graduate certificate program very early in terms of their critical care practice, there can be some real challenges around it. And I think that it'll be interesting to see what the audience feels as to where the practice standards would assist in terms of focusing what Mary needs to concentrate on in her first 3 months of employment. So I'm going to hand it over to the audience to see what your thoughts might be.
Hi Carol and Mel, it's Gilly again. I think our practice standards are really delightful for our new to critical care nurses. They can be used at any stage in our career to help guide our practice. But for those of you, for the new person to ICU, whether they're, and I'm going to look at this one particularly, where they may only have 1 year or 2 years clinical practice under their belt before they come to the critical care environment. The critical thinking and analysis domain, so when we start thinking about standard 10, it's really important for these new practitioners to set down and put down some realistic goals. How do they know what they need to learn? How are they going to be able to see when they've achieved something? So I think it's a really nice way for them to sit down with the standards and have a look at some of those developmental sorts of plans. How are they going to manage? We start them off with really quite simple or quite basic cases, and as time goes by we progress them into the more challenging or more difficult or more complex patients. So it's how are they going to be setting out a plan not only for themselves, but how are we as senior practitioners going to be able to support them?
Your comments, Carol.
That's fine. Go ahead, Melanie. Yes, I'd echo that, and we will show a framework in a moment that probably will better articulate that. I think that the standards could be used as a guide to a conversation, but this very new, if you like, nurse to critical care environment, I would see you could almost take the existing practice standards for the registered nurse and look at overlaying them with these standards, and just begin a performance plan to assist her. Clearly she's struggling with some basic time management skills and is generally disorganised, and I think, you know, in terms of even as I was saying earlier, having a robust conversation with her around is it really time for her to think about a postgraduate course, or should she start to try and have a fairly straightforward performance plan to allow her to have those basic skills applied to the context of critical care, and then once she's got those in development, then to sit down with her and talk to her about how you would support her within a graduate certificate program. So it's probably useful if we go to the next scenario, Mel, and then as we work through that, we can really then go on and look at mapping where these two registered nurses might be on a schematic model. So I'll hand back to you, Mel.
Yes, certainly. So here we've got Joanne. So she's coming towards the end of her her critical care education. So she's at the opposite scale of our previous activity. She's participating in the activities of the specialist nurse, the requirements. So she's going to met calls, she's getting very positive feedback, she's meeting all her performance standards that you'd expect. So the standards have been used to actually ascertain where her performance level is, and so she's going to be actually allocated supported team leaderships on the next roster. So if we use the following framework, and I'll click to the next slide in a moment. So where would you place both our previous person, Mary, and also now Joanne? So this next spiral is, Carol will explain it in a lot more detail, but it's something that came out of a quite a robust research project. So there are different levels to this, and as I said, Carol will speak to this very shortly. But if you look at where the critical care course participant, and you have to forgive me, which is in the middle. Oh, I'm not very good at drawing and pointing on the screen, but if you, thank you. If you look at the critical care course participant, which is sitting at this level around here, then you can see where we've got Mary. I got the right thing, sorry, Mary, where Mary sits at the beginning critical care practice and is hoping to move through this trajectory. And here we've got our next person, Joanne, who is a course participant. And so all the information that facilitates Joanne's practice, so her engagement with the curriculum, with parents, patients, families, etc., and is doing this, of course, where she will sit on this continuum on her pathway to becoming a specialist critical care nurse. So I'm going to just hand over to Carol, who will explain this sort of spiral in a lot more detail, because not all the information's there at the moment.
Thanks, Mel. So if you look at learning as being something that is a ascending spiral, so as we learn, we often go back and repeat our learning, and that's informed by not only you know, our knowledge that we would have from attending lectures and from reading, but also from our experience. You will actually see that it has that cyclic aspect to it, and as we can apply a framework such as Patricia Benner's From Novice to Expert, what we can see is right down this end, and for some reason I'm getting a shadow when I go on to the pointer, but we can actually see that in Mary's case, she's very much down to this level. So she's really at the novice, and as she starts to get more experience, then she becomes the advanced beginner. And so from my perspective, and this is just my personal perspective, ideally when someone comes into a postgraduate critical care course, that they really are at this level. So if they come in at this level, they often are struggling just with the nature of their environment and trying to get their themselves organised and have that sort of experience that they can leverage their learning from. So once they have are into a critical care program, as Melody's already explained, in this developmental knowledge where we align the course curriculum with the embodiment of health professionals and patients and families. This is the coming together of the experience that they learn within a practice-based learning environment. And then as they go through, one would be looking at utilising the practice standards for their performance. Here is a framework, but here is something at the end of their program down this end that we would be looking at applying those standards to. But even if, as you can see here, this is going to deliver what we would consider a competent critical care nurse graduate. And within the research that Fenella Gill has done, what she found was that there were some graduate certificate courses that required to be quite ambitious and articulated that at this end the graduate would be ready to take on those sort of team leader, shift coordinator type roles and demonstrate leadership within a critical care environment. And interestingly, Fenella felt that that was probably a big expectation after a critical care graduate certificate course, which really, if you look at the Australian qualification framework, is a level 8 course, and that if we really expect those higher level leadership roles, then we probably are looking at the person being a bit more down this end towards specialist practice and may need to be complemented by further development of their leadership skills that might be more aligned to a master's level qualification as they move down to this continuum to the area of being a highly specialist and proficient. And what we don't have here is the expert end. Those of you who would be aware of Benna's work would often argue that not all nurses ever reach the expert level, and some of our participants might have some comments about whether you agree or you disagree with that. So I'll just mute my microphone and happy for people to have some thoughts about that.
Thank you for that, Carol. What we might do is take some questions, maybe when we've shown our next person, because I think this leads in quite nicely because we'll come back to this particular model. So I'm going to just hold questions for the moment and just lead into what we've seen so far is that the practice standards can be used for a range of different things. And even as Carol has put onto the little communication board, that they're able to be used to inform the public about the expected practice of a specialist critical care nurse. So our next person that we're going to introduce you to is John. So I'll just have to click again. So John's an RN who's worked for several years in a senior role in another area of the hospital, so in the operating room. He's been redeployed to work in your high dependency, and it's been there for 3 months. And he comes across as very confident, authoritative, and however, the senior staff are really concerned about his knowledge base, ignoring feedback, and he's taking long breaks. And there was a near miss recently in terms of a medication omission. So do you think the practice standards have a place in how John's performance should be managed? And if so, how? So I'll open up that to Jilly.
Standards to him.
That's great, Julie. Carol, did you wish to take over? No, I'm afraid I have to leave the session, so I'm handing over to Carol now to take the rest of the session. Thanks for listening, guys.
Thanks, Mel. You are spot on, Jilly, because if we go back to this framework and we try and map where John might be, he's probably, now he's come out of maybe an environment that he's comfortable in, he's now probably come back around this area. And there's certainly quite a bit of research that exemplifies when people move from an area where they are very comfortable in and may have worked for a long time, may have even done postgraduate qualifications with that area, in that area, and then we take them out of that environment and put them into a new environment. We really should be thinking around the support networks that we need to put in place, because they really do go back, maybe not right back to this sort of very, early part here as at the beginning, but they wouldn't be much more along the trajectory here than a potential advanced beginner. I think the other interesting thing with John, though, is that if you look at the scenario, there are elements with John that talk about attitude. So he ignores feedback, and there's obviously some issues around his whole behavioural aspect as well. And so I probably would be looking at a performance plan with John to look at ways in which we give him absolutely clear examples about his behaviours and examples around where you would want to set his performance expectations. And you might point out to John that there are practice standards for the specialist critical care nurses that he could in fact review and really think clearly in a performance plan as to, does he want to have a career within critical care nursing? Does he aspire to having the support to develop him to demonstrate in a 6 to 12 month performance program to get up to at least an area where he's starting to demonstrate the key performance standards. So I'd be interested in your thoughts about that, Jilly.
I think, as I said once before, I think the standards can be used as a guide. Where we've got the critical thinking and analysis domain, we could encourage John to look at Standard 10, where he, along with his mentor or his manager, could develop and manage a plan of where he might want to be. And I guess you could use the standards as a standard. This is the expected level of performance, and use those to actually ask him, well, what do you really want from working here? Are you here just marking time, or is this a move because you're wanting to develop professionally? That whole critical thinking and analysis domain looks at some of those, how you respond to changing situations, how do you engage with the other people that you work with? So when somebody gives you feedback, what do you do with it? Do you take it on board? Do you ask? Do you seek more information? Do you seek learning opportunities? Or sometimes people have become so entrenched in their behaviours that they might require some performance management to see beyond exactly what they're doing, so that they can actually have an appreciation of the expected standard of care that we would want from a senior practitioner in a critical care environment.
Thanks, Jilly, and as one of our other participants has also indicated in the question box, feels that John lacks insight into his practice. So there can be some application, as Jilly's quite rightly indicated, around the use of the standards, but this may well be a broader performance issue that will need to be managed. So we've come to the end of this webinar. This screen looks at some acknowledgements and particularly the project leads and the members of the project team. So just in summary, what we would like to do is just capture very quickly what we've covered in this webinar. So we've introduced a little bit of the background about the third edition of the ACCCN Practice Standards for the critical care nurse. We've gone through in a broad way the standards and the domains, and then we have used a number of scenarios to demonstrate how the practice standards can be applied. So I do hope that you've enjoyed this session, and we look forward as the ACCCN Education Advisory Panel to offer more of these series of webinars. So thank you.